That's a new arachnoid membrane, artificial one. Gonna fix it on top of the brain. Don't try this. If you try this, you die young. If you try this, you die young.
In the books of SOLOGY 555, it states that the next Yakuza block will suffice.
那么这一条对不对呢？肯定是不对的。I understand here from Professor Wei that you do almost 600 Pituitary tumors, very big experience here in Xinjiang hospital. So
Let's bring it here. That's real human brain. That's the brain.
那么其他的感染中的死可以发现抗感岁的聪明的说明有不需要什么。
其中一个在这儿也是非常常见的，我们已经说了很多例了。这种边缘叶癫痫，现在病房就有一个边缘叶癫痫。
癫痫，我们到底是癫痫还是癫痫？这个大家念法首先就有问题。就是说，你在癫痫你打不出来，你打癫痫，癫痫我们能打出来，还是规范的那种癫痫。但是我们通常约定俗成，我们还是管它叫癫痫，英文呢就是 epilepsy。那中医它叫痫症。还有人在南方人叫羊羔风。
Epilepsy.
应该说这牙的动脉瘤是在上个世纪90年代以后，一般都可以用这个 CVA 的这个开胃。
我们田野主任呢，把脾院长所以这个有倾斜的下午的分工，所以我们这个往这个谢谢大家，谢谢。
Operation is over, and we're closing it. Lonely. Kevin, John Low. See how it is.
Wow, Inter Milan fan. That's cool. Schneider. Wow, Schneider. A lot of surgical instruments. Drilling machines. 你好。
你好，你好。我没带了个英文版给你，哎，算了，我要
有英文的吗？
英文的没带来吧。
所以说我们如果是这么说的，可能我们那个 MRI 可能会更准确，因为 CT 它是看密度。这是医院如果处理管区里面关键各种各样的检查，要做到最后做得好，不同的地方全能显示，全能看到。
这些基础的可以帮助我们看到不断。2012西京脑科论坛现在开始。这个老外有哪个？这老外上次。
Hello. What job? 白主任在哪？
白主任，好，你找白主任哈。
Xinjiang Hospital. An American professor is coming here. So that's my professor, they're waiting for me.
I served in the army for about
20 years.
more than 20 years.
In the army?
In the army, yeah, army hospital. This is 4th military.
We are 4th military.
The Guangzhou University, you know, Miss Deng Xiaoping.
Deng Xiaoping.
We need a lot of military universities, minor school.
This is your mother's school?
Yeah.
So many years. When were you in this school?
1978.
78, yeah, I
the
know.
first military for about 5 years. 5 years. The Deng Xiaoping, that's the Deng Xiaoping's policy.
Yeah, Deng Xiaoping.
Yeah.
It's a very nice university.
Yeah.
Friends
This
and
is the
all that.
hospital. Near the hospital, across the road, the university.
Okay. Oh, these are the nets. We going here? Okay. Here we go. Hello. Okay, I follow you. Hello. I come inside? Okay. Hello. It's a military hospital. You're coming in slowly. The man. It's an African American from Atlanta, Georgia. Was going to give a lecture. I'm Mickey from ATO, Emory University. I'm gonna ask him a question though, no matter what.
大家早上好。我是神经外科非洲。首先呢是从美国来的Oyesiku Professor Oyesiku， 大家欢迎。
Oyesiku.
Very brief
Introduction.
Nelson Oyesiku 教授呢是神经外科内分泌还有分子神经外科与生物工程实验室主任，同时呢也是神经外科住院医师培训部也是神经外科杂志 Neurosurgery 这个杂志里面，他真正的是什么呢？是亚特兰大
From Atlanta Emory University.
所以他的这个涉猎是比较广泛的。那么他的临床与基础研究重点为全球的分子生物学研究与外科指导。他于2009年呢被任命为神经外科，大家知道官方杂志 Neurosurgery
published many articles.
他同时呢在多个国家区担任委员。撰写了多篇 SI 论文，还有专著。那么this is a very brief introduction.
A brief introduction about medicine Oyesiku, neurosurgery. I'm a professor also for neurosurgery.
那上还有一个老外，我不知道是从哪来的，我估计是他。
Me?
Could you please introduce yourself?
Okay, my name is Kevin. I work at xi'an Aerospace General Hospital, and 我刚才来xi'an寒天医院，我跟白医生在想，对，所以我听说一个黑人美国医生来了，然后他请我来看看他，所以 I'm very proud to meet all of you, and I'm happy to be here to listen. Okay, all right.
深深的感谢。
Wow, it's memorable photographing. It's great.
来自美国的Oyesiku 教授来给我们做个精彩的演讲，欢迎大家。We will express our gratitude to have the Professor Oyesiku give very excellent speech here. Right, you can begin.
Good morning. Thank you very much for the invitation, the honor of being in xi'an and in China. Really appreciate the opportunity to be here with all my friends and colleagues to exchange ideas and enjoy the wonderful visit. Thank you. I'll present two lectures this morning, one on pituitary tumors And then the second lecture will be on how to publish in neurosurgery, the journal Neurosurgery, which I'm the editor-in-chief. So I don't have too much time, so I'm going to go very quickly so that we can cover all the things that we need to cover. Several ways of treating these pituitary tumors. We call it multimodality treatment: surgery, radiotherapy, radiosurgery, and also medical therapy, and even some new experimental treatments that are available. Traditionally, we've used the microscope from the days of Guillot and into Hardy, and now we've been using the endoscope more often to treat these tumors. Several causes of hyperprolactinemia that have nothing to do with tumors. The most common, of course, is pregnancy. So you have to ask if it's a female, if the patient is pregnant, and then other kinds of causes such as medication, for example, and so on. So the differential diagnosis of hyperprolactinemia is here. As I said before, one of the commonest causes is pregnancy, and other causes such as medication and stress. So according to the guidelines of the Pituitary Society, of the Endocrine Society, the treatment algorithm is first line of treatment is dopamine agonist, either cabergoline or bromocriptine. As long as the patient is controlled and visual fields show adequate resolution of visual fields, it's okay to continue medical therapy. But don't push the drug level too high, because very recently there have been data about heart valve abnormalities and valvular insufficiency in patients with hyperprolactinemia treated with drug therapy for too high doses. So nowadays, we're beginning to revise our thinking into using surgery a little earlier in patients who require high dose of drug. So don't push the drug level too high in patients that require that. And look at this example of a tumor we treated with medical therapy that responds very, very nicely to drug. You see the shrinkage and the resolution of visual fields deficit. Next slide. This is a very good example of this case of a patient you see with a very invasive tumor, and the patient diluted prolactin was 38,000, and then we obviously put the patient on medical treatment, and you see here the patient then developed a CSF leak, and we had to go in surgically to repair the CSF leak and then put the patient on medication, and that's a very good example of the skull-based tumor. So when do you need surgery for prolactinomas? As I said, when the medicine doesn't work, if it fails, if the tumor does not shrink, even though the prolactin level comes down, sometimes the tumor will not shrink, and so you have to go and operate. Sometimes if the patient has hemorrhage or cystic changes in the tumor, those tumors will not respond well to medication at all, so you have to operate. In the case of acromegaly, those are patients with excess growth hormone tumors, a diagnosis to make. You can just look at the patient and you get an instant diagnosis. And I've actually seen patients sometimes in the airport or on the street and say, you have acromegaly, go and see your doctor. And they've done that. And we have a GH receptor antagonist, pegvisomab. These drugs are very, very expensive. I'm sure it's the same way here. So it's very important as much as possible for the surgeon to achieve a cure for these patients, because otherwise they need lifelong treatment with these very, very, very expensive drugs. So these are the different ways this we can do. Operate with the microscope, macroadenoma. We can do, sometimes what we do is a combined simultaneous operation where the surgeon from the endonasal approach, and then the patient, another surgeon with the cranial approach simultaneously. And you see this little drape, and then we're working combined from both sides at the same time. Doing initial glasses and so forth. So this is our situation here. This is a case of a patient with a combined simultaneous operation with giant adenoma. You see here subfrontal, all the retrocellular, clivus. All right. So we've started to use the endoscopic approach, and you can see here through the this is a Storrs 2D endoscopic approach, plenum sphenoidatic, carotid, cellar floor, clivus. So it gives you a wide field of view in these cases. So here's our we've done this. We introduced it in 2009, and you can see this is a paper in Allergen. We use the 3D goggles and a 42-inch, a 46-inch, and a 32-inch. And you can see here the patient position, and then you want to keep it a little far, maybe about 10 to 12 feet in front of you, so you don't have any problems with blurring or headache or something like this. Very soon this monitor is going to be available, so you don't even have to wear the glasses. You can just look at the monitor and you see what you need to see here. So since we got that, now we've done almost 500 patients with this, with the 3D endoscope. So, thank you very much. I will talk about the next talk in a minute.
A new idea about the modern strategy to the pituitary tumor, with emphasis on the chemical drugs in application before operation and in the evaluation of prognosis.
I don't know why they got police people standing all over the place. It seems so good out now. Kids having fun out there. It's cool.
Yo, man.
Why this guy keeps saluting me, you know? Ni hao.
Ni hao.
Oh, you can speak English. I'm fine.
你会说中国话？
对，我会说中国话。
哦，那我就会说一两句这个。
How are you?
How are you 之类的。
还有 Hello.
Excuse me.
Excuse me. Yeah, excuse me.
是会说几句。
OK， 再见。
好，再见。好。
So many police people around, and this is Xi'an Hospital. Street. Yeah, I take a walk inside here. They have a nice, cool atmosphere. Nice atmosphere here. Some music going on here. I don't know where the music is coming from. I think the music is coming from here. A lot of pictures they paint with these statues, like good medical care and all that, you know. This is a beautiful place, pretty. Music all over the garden. This is also another picture they're trying to paint here. Doctors and patients, you know, it's all medical care.
我们大家回想一下，我们在上学的时候，老师告诉我们说 ，OK， 你如果要是从这个 除非你是从大山里来的，或者你免疫力很低，你们做这个 PPD 实验，就是结合的这个皮球、这个皮试实验的话，都是阳性。阳性代表什么呢？代表我们在座的各位通通感染过去了。那么这篇文章呢是 Nature Medicine， 2011年3月份的一期。那么它呢就是把这个 T-spot 把它改良了一下，然后呢它特意的把分泌 TNF 阿尔法的这个 T4 阳性细胞分离出来，如果这一部分细胞呢表达的这个 T-spot 的阳性的话，它就代表了腺症感染，这是我们的阴性。这个需要我们什么呢？需要我们要抽至少10毫升以上的脑汁。
Talking about meningitis, electron meningitis.
10毫升那个来得及的，那么这个我们这是国际惯例。但是呢，我们做不到，我们经常需要用这些临床的综合的诊断，可能是这样。
尤其是它这个眼睑基质卵，我们遇到很多例，它不容易被家属发现，然后发现了也不知道它是咋回事儿，不容易到神经科来看啊。那么这个时候的修改呢，它是根据这个癫痫发作时候的表现，就是异常放电的起源不同，分为4大类：婴儿和儿童局限性癫痫。 这里边又分为这个3类，这个不详细讲了，讲了大家可能也记不住，但是有几个要说一下。一个是早发性基质卵性脑病，第二个是大田园综合症，第3个是外死的综合症，第4个是婴儿严重基质卵综合症接下来呢就是非进行性脑病中的基质卵持续状态，还有一个非常常见的在这儿 Lennox-Gastaut 的综合症，这个呢也非常常见，属于一种难治性癫痫综合症，也是一种癫痫脑病。还有 单的 collecting 的综合症啊，这个 LG 综合症，那后边呢我会用个病例给大家介绍一下。
因为这个动脉瘤非常小，如果是通过导眼钻的话，有时候很难进去。那么我们先承揽。那么，因为它既有缺血又有出血，那么一般来说，我们既缺血又出血的情况下，先处理出血的情况。那么这个动脉瘤一旦破裂呢，我们还是首先呢建议，如果能做介入治疗的话，首选这个，只要微导管能到位，进行填塞的话，应该是没有问题的。有安全、微创、有效的特点，是不是填塞呢？尤为可靠。那么治疗时机越早越好。我就回到我的建议。
So it's over. End of the show.
Professor Liu.
Professor Liu.
Use endoscope specialist.
Endoscope specialist.
Endoscope.
Oh, wow. Nice to meet you. Okay. So that's Dr. Bai there. He just dropped me off. He's gonna give a lecture here. Good hospital. It belongs to the Air Force, China Air Force. So today there's gonna be another lecture here, all about neurology and neurosurgery. So it's Liberation Army, 1951. We'll go inside. You can see the army people. At the army guys, they're looking at me. I think they don't want me to make a video here. No, but you know.
为啥讲这个呢？我想呢，其实在门诊经常我们看到一病人会拿了一个，在县医院啊或者这个医院做了一个CT说，哎呀，这是脑梗塞，我们说没有，他说有。
这个病我们那个病人术后以后没有瘫痪，两个病人都没有瘫痪。我们做个改良手术，没有像老外那样彻底切得那么全。你可以看那个图，下一次我们把我们那个东西呢放在那个 xanawz.com， 我们放在我们那，我可以把我那个资料放在我们那个上头。我们切的是有限的，然后他们切的是比较让人害怕。
这个呢，为什么有些病号感染以后可以治愈，但有一些这个病人呢发展之后死亡了，这就是因为这个真正的细菌感染引起的炎症反射，它这个可以通过抗菌素呢进行治愈的。但是其他的过度的全新的炎性反应综合症，那是你看是治不愈的，所以这些病号它就会死亡的。
这就掉下去了。
主要是现在就是脑膜。
We're gonna fix a new arachnoid membrane, new arachnoid membrane.
不够是吧？
不够，
肯定不够，越大越贵啊！
越大越贵，
越大越贵。来开了，稍微把那口拨开看了一下，干干的。
这样。
算了。
这个后面在后面，应该。
因为它卷起来了。
对。Okay. This one is better.
Okay, 送。
I think it's okay. Dr. Lonely loves Nicolas Cage. 他喜欢 Nicolas Cage. John Woo, John Travolta, Nicolas Cage.
尼古拉斯凯奇是吧
Yeah, he likes Nicolas Cage.
还有那个谁，就是
And 今天 John Travolta
史泰龙，
是不是史泰龙？
今
天他给我敢死队2，
那里面全是大明星。
The Expendables 2 with Van Damme and
几乎所有美国的
Commando and Schwarzenegger. 30th October 2012 and it's 2:05 in the afternoon. Started the operation 9 a.m.
开完，你应该去看一下3D 电影。
Yeah, after the surgery, I'm gonna watch a movie. Expendables 2.
然后州长。
So I'm gonna watch Expendables 2.
This zone is terror, beauty is scary as it is. Spirits handle our biz, you know the tricks. No love, it's all lost, man.
Yeah, Dr. Fans car 很好啊。 This one, Inter Milan. Wow. Gorgi Milan. Really. That's Dr. Fan. We're leaving the hospital for a Neurosurgery Summit. He's a famous neurosurgeon here and he specializes with tumor, any kind of brain tumor.
我刚25说走了，然后一个驾驶把我给拦住了。
It's scary, yo. Welcome to the world, you know. It's been ages under the rocks. Yep, I know Crondia King. In your heart, the crucified, the drenched. New world, orders, new dawn. From dark to dawn, our souls bleed. Pip the scene with open mind. Let it be light. And take a stroll with me, make it DC. Homo sapiens, design to bleed.
24 from Neurosurgery Summit. Everybody's a neurosurgeon from all around China, all the big men. So this is the nurse I came with. She's my nurse at the neurosurgery department.
可能就是开幕式。
那我们走吧，直接走。走。
The new world.
这个需要什么样的肯定要闪动，这在这里面非常重要。
近一半的时候，应该刚好在正面对角线的那么我们首先呢，还要发挥我们前面的强压的这种形成的这种基础。那么我们这个定义怎么讲呢？不要在这一部分不要在放，这个切口啊，让你皮肤往对比其他，这个精准不是在直接用皮肤而是用皮下。就是做完以后，手端从你看大脑爬得高好，你的脑子一点压上没有。那么一样，通过医生的辅助给做完，当时的事情让医院慢慢能站起来了。那么我要保留，这是另外一个同样技术做完，对这个钙化的当液。那么这个呢也是术前术后，这个呢是主观方面看两侧都有啊。这个这是术后。那么像结尾脑瘤，更不说从这一块进行做，就适合做所有手术的一个发好，做好了手术显露好了，我们把这一块图片处理好，谢谢大家。
Welcome to Kinesiologist's world. Moby Dextro stiffening. You know this is our world. The new world. Charlie, we too guy man for this level. Charlie, we too guy man for this level.
All the surgical instrument.
Oh, 中英对照的。
OK，谢谢。
这个是白领的。
你好，谢谢。
双脊垫顶点的补上这。
OK，你把这个放在书里面。
因为我是从广东那边过来的，我的普通话还不那么好。
哦，你是广东的。
对。
哦。These are the titaniums they use in meshing the head. Hello，
你好。
OK，有英文的吗？
英文的我到时候给您寄好不好？您可以给一个地址吗？
一个地址。
对，我们有英文的很多，我们公司的产品很多。
你的名片在里面，所以我会给你们打电话。
好的 ，Thank you。
On the throne, BBC, CNN, I'm up for life. A black Nazi dread representing precious metal crown, 100%. I'm fucking with ya. Let's set the picture. You skip through, they come and get ya. Sometimes with the sister, yep, and Mona Lisa, or painted more bloody. Leonardo da Vinci, PSD, fiercely. With a couple of G's, forgive them, Jesus Christo, please. Yeah, they try to kill me. All blood is rougher than you think, kid. This zone is terror, beauty is scary as it is. Spirits handle our biz, y'all know the tricks. No love, it's all lost, man.
So this is where it all went on.
No love, it's all lost, man. Welcome to the world. The new world.
Bromocriptine and D2 density. You know, I really don't understand what you mean by D2 density. Acromegaly, you talked about peviximab drug. Honestly, I haven't come across a drug, and I want to know the side effect of those drugs. With the other one, you talked about going through the groin, interventional, and when you reach the cavernous sinus, you check for the ACTH lateralization, and you said it's very confusing. So I would like to know more about that, because I also don't have an idea about that. And you talked about Nelson syndrome.
Yes.
Does it have anything to do with your name, because you are also Mr. Dr. Nelson? Thank you very much. Okay.
So the last question is that no, Nelson syndrome.
Okay.